where is the problem? You've said planning, Kenya has good planners. There's a problem with implementers now, and you're saying that the Treasury does not allocate some of these funds in the right direction. Is that what you're saying? Is that where our problem is? From when you talk about fiscal discipline and lack of proper allocation, is that where our problem is?
Let me give you an example. We used to collect 180 billion 9 years ago in taxes. We are collecting 750 billion today. All that is going towards recurrent expenses. What does that tell you? There is fiscal indiscipline, right? You are living beyond your means.
You're living the life.
Right? Yes, we are living the life, as you might call it. And therefore, that's why I said, I will attack the budgetary system. I will instill disciplinary measures on fiscal so that we can make a savings and take it to some of these things that we so much need to revamp our economy and to fight the two serious challenges.
I want a direct and more clear statement from you on this. When you say you attack the budgetary system, do you think it's the officers or is it the structures that we have in place at Treasury?
You know, I was actually very direct. That's why I gave you the two figures. That we are collecting 750, we were collecting 189 years ago, and all this is going to recurrent expenses. And you said that we are living the life. That is the position. We need to tighten our belts, right? And say we must reduce travel by government officers, right? Both locally and internationally, and make a savings. We must check at how much it costs to maintain our vehicles and decide whether we want to uplift the salaries of the officers in lieu of transport, if it will make economic sense. Because it should. We are spreading so thin, we have so many things we want to do at the same time that it doesn't make sense.
That's what
I prefer to do fewer things, address 5 things, make them good, and move on. When you say we are doing the same thing, you're not right. We have 40 ministries. Each ministry has a requirement and a demand. We can't move at the pace of 40 requirements. I have restricted myself. I have restricted myself. You're going to have 22. But you still need to sort yourself on 5 issues as the baseline to revamp the economy. That's what it means. For example, would it make sense to put money into the Ministry of Fisheries, to put up ponds, and you haven't come up with marketing strategies for those fish that will come from those ponds? Or would you rather use that money to put one huge dam which will supply water for drinking and for irrigation? These are the questions we need to ask ourselves. That you do fewer things that will have more impact on the people and will bring equality to everybody.
Let's go into education.
Yes.
What is it that you want to do with our education system? Is it our system that's wrong?
I think we need to reform our education. First of all, and I said this, it's good to have free primary education, but we now need to go to the quality of it. 2, you need to have courses that gear towards the economy. Instead of just offering courses just for the sake of offering courses. And 3, we need to realize not all kids make it to campus. What are the options for those who do not make it to campus? I think, and I've said this, we want to invest on national polytechnics at each county so that we can drill our kids into semi-skilled and skilled kind of labor, which will then beef up the manufacturing sector. So we need to have those reforms.
When you talk about the semi-skilled, and sometimes I get mixed up by this. When you say that we come up with polytechnics, rural polytechnics,
not rural, not village, not village, not village. What was MIT in the US? It was an institute of technology initially. Right. I think we made a mistake.
It was producing skilled workforce.
I think we made a mistake.
A semi-skilled.
I said semi and skilled. Those were my words, right? Because you have to have levels, right? We made a mistake of converting polytechnics into university colleges. That's what I am saying. But I want institutions that can compete with universities in terms of skills. They might not offer a degree, but they will offer skills. And the reason and the rationale behind it is that one of the sectors I want to use to build the economy is manufacturing. One, because we have excellent trade treaties. COMESA, EAC, and we have good neighbors like South Sudan who we should take advantage because they lived here and we know them. Yeah. So that's why I'm insisting that you need these polytechnics so that you can actually build your manufacturing sector.
Are we changing our curriculum? Because these polytechnics currently as they are, they're training what woodwork, mechanical engineering.
I think
using people who go to, the most they can do is service a car.
I think you need to put your mind off from the village polytechnics. You want people in village polytechnics who will go to a national polytechnic and actually graduate with a diploma and will be hands-on and will go into the manufacturing sector. So if you notice, we have a gap between village polytechnics and the actual, that's what I want to address. Okay. Yeah.
Healthcare.
Yes.
We have a dilapidated healthcare system. One of the reasons why the doctors kept going on strike, and I interacted with them and hosting them on this show, is the doctors were saying, look, number one, don't even address the brain drain yet. Let's talk about the facilities on the ground. We know you are in the planning ministry, so you participated in the preparation of their 4 previous budgets. We've just been hearing the minister read.
No.
And saying,
we don't participate in the budget planning.
So why do you wear that?
I told you, and I'll tell you again, and you haven't seen me escort the Minister of Finance.
Your minister does?
Yes, because we're in the same building. We have not been involved. The MTEF, the medium-term expenditure framework, is housed in Treasury, right? The revenue, the fiscal and monetary, is housed in Treasury. These are facts and they are factual, all right? We can come up with the best plans, but if you do not assign funds to them, we can't do much, right? We are a supporting institution to all the ministries, right? Our work is to try and align planning. We have no...
You suggest you have no executive power?
Yeah. No, we do not have an input onto the expenditure.
Okay. The point I was making was we would come up with serious hospitals, good, well-equipped hospitals in each county in this budget. In the previous budget we had the same thing, but we're not seeing it happening. We have had issues to construct new hospitals in every county and make them level 5 hospitals or so. But then the issue of equipping these hospitals, the issue of when you get into a hospital and the laboratory is actually working, and you get there and you can actually find a scanner that's working.
My plan is very simple. I've said I would like to have another 45 referral hospitals because we have 2. Our systems are overstretched. I grew up in a city council healthcare system where the dispensary had all that it required. Had a doctor, had the equipment, had the medicine.
Just come home,
and if things didn't work, yes, if things didn't work, we went to a city council health center. Now, what happened is that these facilities got overstretched. The population grew, the facilities remained the same. So they were completely overrun by the population. That is one serious challenge. The second challenge, which is even more serious, is that we now suffer from lifestyle diseases which were not there at the time, right? If you remember very well at the time, the serious challenge was malaria. Even typhoid was not there because the city council was able to treat the water. So you didn't get typhoid, right? But today you have all manner and sorts of diseases ranging from typhoid, going to cancers, going to diabetes, going to hypertension. All these are lifestyle diseases. Now, with a growing population, which has actually grown, and with lifestyle diseases, you need to come with a new plan. And I've said, I appreciate our doctors very much. In fact, they work under very poor conditions. First of all, they are poorly paid, right? Two, they have the Hippocratic oath. They feel frustrated with it. They want to help patients. They are not able because there is no equipment, right? Now, how do we sort out this mess, right? My plan is to use 45 billion in the first 1 year to just put up the structures. Use another 45 billion in the second year to just bring in equipment. And in those 2 years, sort out the personal welfare issues.
So 90
so
billion
that,
in 2 years.
yeah, so that you can also attract our doctors who've gone out back to Kenya. Because we need a healthy population.
But you've said that you want to put up 45 other Kenyattas across each county, right? What about the small, what you've talked about, the clinics?
Now,
why don't you start sorting
now
out?
you need a referral point to be able to move downwards. It will be top down, all right? Do you know why Kenyatta is in a mess? Any of all those hospitals is sending everybody to Kenyatta.
It's no longer a referral.
Yes.
People are going there.
Right?
That's the first point.
That's what I'm saying. Everybody is sent over there. Now you need a referral point for all those others. CDFs have done quite a bit in establishing dispensaries across the country. We just need to align them, and they have a reporting point. And they also have a supervisory position in a referral hospitals that then caters for everything down. Let me give you simple things. If you had machines to just check breast cancer, cervical cancer, prostate cancer, forget about urbanized areas. Just think about rural setups. Would sort out lots of problems, would save lots of lives. That is the area I want to go into, so that you don't have to leave your county. Remember, every time you make a journey to Nairobi, you are taking off coins from a poor patient. Remember, every time doctors go on strike, the poor cannot afford private health care. They suffer, and they are the biggest population.
So you're thinking of creating new hospitals or just upgrading some
No,
of the
new.
Thika has Thika
No,
level 5.
new.
Put up a new structure.
New.
New everything.
Remember,
So what's the
Thika,
position?
remember Thika is in Kiambu.
All right.
So you'll have to look at a central place in Kiambu and put a referral hospitals, right? Murang'a the same, right? What you then need to do is to align with the level 5 and level 4 so that they report to the referral hospital. Once you finish with the bigger picture, you now align the structures down up to the dispensary. That's the only way you can take care of the population from a health point.
I'm going to get into the question of where the money is going to come from.
I have no
But
problem.
let's talk about where the water is going to come from.
Yes. I want to put up a dam in every county, if possible.
A dam in every county.
Yes. Remember, we have depended on rain-fed agriculture all these years. With climate change, we can't. Just remember that. I told you earlier that we have a growing population, right? Now you have to feed it. So you have to go to agriculture based on irrigation. Now, we are a water-scarce country. But look at the rains that we've had this year. Have we collected any? We haven't.
We've collected it.
We haven't.
In the Indian Ocean.
Well, is it of help to us in that point of collection?
Not anymore.
Not anymore. If you look at a county like Mandera, they don't have rivers. But they have rivers that come from Ethiopia and flood Mandera town. We just need to build a dam that can get that water when the river floods into Kenya. If you look at Kwale and you look at the rivers there, that you would convert Kwale into agriculture. Remember, you have Ramisi sugar working. If you collected water that comes from Usambara and you created a dam, you'd feed the population by way of irrigation, but you'll also have fresh drinking water. Now, we have to build dams in the next 3 years to collect water. If you look at the dam in my county, in my constituency in Dakaine, it was built 20 years ago, purely to supply water to Nairobi. At that time, it was enough. Today, it is not. Look at